Hello, everyone. My name is Kasey, and welcome back to the third module of our educational series on overdose awareness, educating youth in Canada. Today, we will be focusing on an important aspect, knowing how to respond effectively in case of an overdose. Our goal is to equip you with the knowledge and tools that you need to recognize the signs, take immediate action, and manage the emotional impact that can follow such incidents. Here's what we will cover in today's session. On the agenda, first we have recognizing the signs and symptoms of an overdose. Then we'll be moving on to immediate response actions to take when you suspect an overdose. Following that, managing the emotional impact of witnessing an overdose and understanding the role of emergency services. So let's dive right in. Recognizing the signs of an overdose quickly is crucial for saving lives. There are physical symptoms like difficulty breathing, unconsciousness, pale or clammy skin, and slow or absent pulse. Psychological symptoms can include extreme anxiety, panic, hallucinations, delusions, and even depression or suicidal thoughts. Lastly, behavioral symptoms such as confusion, erratic behavior, and the inability to stay awake are key indicators. Always stay vigilant and act fast if you notice these signs. Immediate response actions. When you suspect an overdose, your immediate response is critical. The first step is to call emergency services, provide clear information about your location, the condition of the person, the substance involved if known, and any actions you've taken, such as administering naloxone or starting CPR. Accurate information ensures the right help arrives quickly as possible. Moving on, emergency services need accurate information to send the appropriate help quickly. Knowing the substance involved helps medical personnel prepare to treat the overdose effectively. Every second counts in an overdose situation, so providing clear and concise information can be life saving. Administering naloxone, or also known as Narcan, and training on how to use it. Naloxone is a life saving medication that can temporarily reverse the effects of an opioid overdose. Here is how to administer it. First, check the signs for opioid overdose, such as unresponsiveness and slow or no breathing. Administer naloxone via nasal spray or injection, following the instructions provided within the kit. If the person doesn't respond within 2 to 3 minutes, administer a second dose if available. Naloxone kits are often available for free at pharmacies, community centers, and some healthcare facilities. Remember, naloxone's effects are temporary, so emergency medical attention is still crucial. The person may require further doses or additional care to fully recover. Performing CPR basic techniques. Step 1, check for breathing. If the person is not breathing or only gasping, begin CPR immediately. Move on to step 2 with chest compressions. Place the heel of your hand on the center of the person's chest and place your other hand on top and push hard and fast, at least 2 inches deep at a rate of 100 to 120 compressions per minute. And if you're trained, perform rescue breaths. After every 30 compressions, give 2 rescue breaths by tilting the person's head back, lifting their chin, and pinching the nose and blowing into their mouth. CPR helps maintain circulation and oxygen flow to the brain and vital organs, which can prevent severe brain damage or death until emergency responders take over. If you're trained, chest compressions alone can still make a critical difference. The role of emergency services and understanding the process once emergency services arrive. The initial assessment. So, when emergency services arrive, the paramedics will take over and perform a quick assessment of the situation. They will check the person's vital signs, such as pulse, breathing, and level of consciousness. They will provide immediate medical intervention based on their assessment. They will administer life saving treatments, such as additional doses of naloxone if it's an opioid overdose, oxygen to assist with breathing, or other medications depending on the substance involved. Transportation to hospital. So, after stabilizing the individual, paramedics will likely transport them to the nearest hospital for further evaluation and treatment. This is crucial as the effects of the overdose can reoccur, especially in the case of opioids, where the effects of naloxone might wear off before the drug is fully out of the system. So, moving on, more on the role of emergency services, but the importance of providing accurate information to paramedics. So, substance details. If you know what substances were taken, how much, and when, it is vital to share this information with the paramedics. This helps them tailor their treatment approach and ensures that the person receives the most appropriate care. Providing medical history. Inform the paramedics of any known medical conditions the person has, such as allergies, asthma, heart conditions, or diabetes, as these could impact their treatment decisions. Make sure to let them know if you have administered naloxone, performed CPR, or any other first aid measures. This helps paramedics understand what has already been done and what further interventions might be needed. This all helps ensure the person receives the most appropriate and effective care. Legal protections, the Good Samaritan Law. Protection from prosecution. The Good Samaritan law protects those who call for help during an overdose from arrest or prosecution for drug possession, encouraging people to seek emergency assistance without fearing legal consequences. Scope of the protection. The law generally protects the overdosing person, the caller, and others present from drug possession charges, but it doesn't cover crimes like trafficking or outstanding warrants. Importance in reducing overdose deaths. By removing the fear of legal consequences, the Good Samaritan laws increase the likelihood that people will seek emergency help during an overdose, potentially saving lives. Managing the emotional impact. Potential emotional and psychological impacts of witnessing an overdose versus trauma and shock. Witnessing an overdose can be incredibly traumatic experience, especially for young people. The suddenness and severity of the situation can lead to feelings of shock, fear, helplessness, and even guilt, particularly if the person overdosing is a friend or a loved one. The long-term emotional effects can include psychological impact that may not be immediately apparent but can manifest later as anxiety, depression, flashbacks, or even post traumatic stress disorder, or also known as PTSD. It's important to acknowledge that these reactions are normal responses to an abnormal situation. Recognizing and acknowledging these emotions is the first step in managing the psychological impact. Strategies for coping with trauma. Coping with trauma requires support. Talking about the experience with trusted friends or peers, seeking counseling, and joining support groups can be incredibly helpful. Engaging in activities like journaling, art, or physical exercise can also be healthy outlets for processing emotions. Incorporating grief management. Grief after witnessing an overdose can be deep, particularly if it involves someone close to you. It's important to recognize the different stages of grief: denial, anger, bargaining, depression, and acceptance. And to find healthy ways to process these emotions, such as through creative outlets or therapy. The Center for Grief and Healing is a safe space where individuals and families can find the support they need during difficult times. Whether through personalized one on one sessions or group support, we provide compassionate care to help you navigate your grief journey. What's up next? In our next module, we will focus on building a supportive community and ongoing prevention strategies. The goal is to empower you to engage in overdose prevention within your communities, support peers and loved ones, and maintain mental health and wellness. Thank you so much for your attention today, and we hope you continue with this journey with us. Thank you for participating in this session. If you have any questions or need further support, please feel free to reach out to us at info@bereavedfamilies.ca or call us at 905-848-4337 extension 0. We are here to help. This educational series is supported by the Center for Grief and Healing, Bereaved Families of Ontario, Halton Peel.